Hi everyone. Today I'm going to be talking to you about authentic movement. And authentic movement is something that I'm really passionate about. I think it's such a beautiful way of creative and psychological expression. Essentially, it's been around since the experience of humanity began. Authentic movement can be anything from standing still to wildly moving and dancing and creating all sorts of different forms. But authentic movement is something that the the human body understands from a very young age, because it's part of our developmental patterns. The body has these impulses, these intuitive senses and wisdom that already lies within our bodies, and these are the principles of authentic movement, is to, quote, learn from the body's own experience, insights, and imagination, end quote. It's used in a multitude of settings, ranging from creative to clinical environments, and outwardly it looks pretty simple. So, from a viewing perspective, somebody were to observe authentic movement being practiced for the first time, it might not look like anything that would be super specific to a movement form, but the psychology behind it is what makes it really complex and so fascinating. Authentic movement is generated when a subject moves through impulses that are generated authentically, that they wait for their body to generate these impulses and then they accept them rather than judge them, is the second component of that. Formally, the practice originated in the 1950s and 60s when Mary Whitehouse, she was a dancer, she was enthralled with the work of Carl Jung, and she started doing some research about how Jung's principles could be incorporated into movement practice. And it says, quote, Jung recognized the importance of the body as a means of expressing unconscious material and tried to understand the underlying meaning of physical symptoms and somatic disorders, end quote. So she was inspired by this idea that Jung had started to research. Jung had done some research on this same line of movement research, but instead called it active imagination. So alongside of Mary Whitehouse and another dancer and dance therapist, Mary Wigman, they kind of merged their worlds together, Whitehouse having that psychological component and Wigman having more of the creative side, and they came together to create this foundation of authentic movement practice. And in 1981, Janet Adler, another dance movement therapist who was quite captivated by the work of Whitehouse and Wigman, founded the Mary Starks Whitehouse Institute, where practitioners could train in this movement and deepen their experience with authentic movement. So, as I said just before, active imagination is how authentic movement became something that was practiced, created by Carl Jung, and that was its original term. He noticed that, quote, patients may communicate somatically what cannot be expressed verbally because it is not yet available as mentalized experience, end quote. So basically, in a clinical setting, this could be used to get in touch with healing traumas or working with PTSD or schizophrenia, things that are not so easy to verbalize for patients. And truthfully, it can be just as beneficial outside of a clinical setting to heal personal trauma or trauma from childhood. Things come up in these movement forms that are really, really powerful and significant. What sets authentic movement apart from other dance movement therapy practices or other exercises or techniques used in a psychological or clinical setting is that it typically involves an observer as well as a mover. So there's a component of partnership here where the observer is watching and witnessing what the mover is doing, and similarly to a mother-child relationship, does their best to try to impart any notes of reflection or anything they saw symbolically that came out through that movement, to try to talk through with the mover and see if they can kind of pull out from that unconscious, that subconscious level of psyche, what is coming out through these movement forms, especially when it comes to traumas and things that are difficult to verbalize. So, as I said earlier, authentic movement is generated from impulse. So without impulse, there is no movement. And in these cases, stillness can even be considered a form of authentic movement, because the fluid systems within the body are moving. And if you're not receiving that impulse, then the authentic thing to do would be to stay still with your body. These movement experientials are quite internal experiences and very personal to the practitioner. So typically the eyes are either closed or downward cast, really taking the focus inward towards the self, and all aesthetic expectations are released in true experientials of authentic movement. There are no technical aspects of this practice. In fact, it's quite the opposite. In my opinion, this is true beauty of movement, that your body and your psyche can generate these impulses that just have you move in these forms that are creating these symbolic, beautiful narratives of your life. And to me, that's even more beautiful than the most incredibly technically inclined mover, that our bodies can generate these stories without us even consciously telling them to. It's been noticed that authentic movement that is practiced for healing tends to result in forms that are consistent with symbolic process. So that is really impactful for situations that are difficult to verbalize. Again, those symbols almost allow the observer to read and derive the narrative from the movement, and in turn have that moment of analysis and reflection with the mover, talking about what some of these forms meant, and working through these healings in that way. So because of this relationship between the observer and the mover, the effectiveness is really strongly based off of the strength of that relationship, that trust and the vulnerability. It's very key in having this experience be a form of healing. The mover must trust the observer to not judge them, and to hold their really, really personal story that is coming out through their movement patterns, and be able to talk about it afterwards. And likewise, the observer has a big responsibility to watch as the story unfolds right in front of them. Currently, there is no organization that oversees authentic movement. However, practitioners should always be mindful of the guide that is guiding through the experiential, their credentials, and making sure that they are familiar with some of the foundational aspects of how to integrate the exercises and some of the psychological components and things like that. Anyone can really benefit from authentic movement. It's been used, like I said before, to heal things like schizophrenia, depression, childhood trauma, PTSD, and that's just only a few examples. The narratives that are unlocked are truly unique to the psyche and imagination of the practitioner. Really, there would be no circumstance where this movement practice would not be feasible. Even the smallest movements, or if you're immobile, stillness is even authentic movement in a way. So really, this can be implemented in all scenarios. Obviously, you would never use this as a healing modality in the case of an emergency or immediate medical attention. But as far as deep healing, integrative medicine, this can be a really, really wonderful way to embody imagination and let it take form. And when movement is generated by an authentic impulse, the expected, beautiful nature of this movement practice is observed. I hope you enjoyed listening a little bit about authentic movement, and maybe try it out for yourself. Bye.